Hello everyone, welcome back to another episode of Hair Talks by Terra Medical. I'm Dr. JC, and today we'll be diving into a topic that many of us are curious about: hair growth supplements. It's essential to separate fact from fiction. Join me as we explore the science behind hair growth supplements and uncover the truth about their efficacy. Supplements such as biotin, vitamin D, iron, zinc, and omega-3 fatty acids are familiar players in the hair supplementation world. But how crucial are their roles in promoting hair health? Hair growth supplements often contain a variety of ingredients believed to enhance hair growth. It's essential to distinguish supplements backed by scientific evidence from those with anecdotal claims or limited research. I'll be touching on 4 of the most common ingredients that you may see in most hair supplements, namely biotin, saw palmetto, iron, and zinc. Biotin, also known as vitamin B7, plays a crucial role in the health of our hair, skin, and nails. There's evidence that biotin improves hair growth, but these are only in patients with inherited or acquired biotin deficiencies. However, the incidence of biotin deficiency in a developed country like Singapore is rare due to the abundance and variety of food that we have. A 2020 study tried to find a link of biotin deficiencies in 16 individuals suffering from telogen effluvium with 20 control patients and found that serum levels of biotin were optimal in both groups of patients with no significant difference between the groups. However, if your hair supplements do have biotin, do be aware that FDA issued a warning that it may interfere with certain blood tests such as troponins, thyroid function tests, and parathyroid hormones. Thus, biotin only works if you have a known case of biotin deficiency. However, these cases are uncommon and there is a lack of evidence for supplementation in healthy individuals. And next up, there's saw palmetto, which is often included in hair growth supplements due to its potential to inhibit DHT, a hormone associated with pattern hair loss. It blocks the 5-alpha reductase enzyme 1 and 2, akin to dutasteride, and has been recognized for its anti-androgenic effect since at least 1500 BC. However, its efficacy for the treatment of androgenic alopecia remains controversial when administered orally. While some studies suggest a positive impact of saw palmetto on hair thickness and growth, the evidence is not yet conclusive and further research is required to validate its efficacy. My personal anecdotal evidence, based on observations in patients, indicates notable improvement, particularly amongst female pattern hair loss patients. However, since the supplement also comprises of other active ingredients, drawing an exact conclusion about whether saw palmetto is solely responsible for this improvement proves pretty challenging. Next up, there's zinc, an essential element that cannot be synthesized by the body. Its significance extends across various biological functions including hormone signaling pathway, wound healing, cell division, and also stabilization of RNA and cell membrane integrity. Zinc has been associated with shedding events known as telogen effluvium. There are also multiple studies showing the relationship of zinc and hair loss. In a study conducted in 2007 involving 44 females experiencing hair loss, it was found that 23 out of 44 participants had zinc levels below the normal reference range. This suggests a potential association between zinc deficiency and hair loss. Similarly, a 2016 study highlighted the link between zinc deficiency and telogen effluvium. They emphasized that the prevalence of deficiencies in vitamin D, ferritin, and zinc is significant enough to warrant their inclusion in the clinical evaluation of individuals experiencing hair loss. Last but not least, let's discuss iron. Iron deficiency can present in various ways and doesn't always result in anemia. It's quite common, especially amongst premenopausal females patients in our clinic. Measuring serum ferritin levels is a useful method for assessing iron source. Although the exact mechanism of how iron affects hair is not fully understood, its link to hair loss is well documented. A study in 2013 supports previous findings that iron deficiency can contribute to the development or worsening of female pattern hair loss, particularly in premenopausal women. Amongst 210 female patients with pattern hair loss, those with pattern hair loss had significantly lower iron stores compared to age and sex-matched controls. Premenopausal women with female pattern hair loss also had much lower levels of iron than compared to postmenopausal patients. Additionally, patients with male pattern hair loss showed considerably lower iron levels than healthy controls, even when serum ferritin levels were within the normal range. Another study in 2013 found that patients with androgenetic alopecia and alopecia areata had significantly lower levels of iron compared to individuals without hair loss. Another study demonstrated that oral iron therapy significantly reduced hair loss and increased iron concentration in patients with halogen effluvium. In conclusion, maintaining adequate iron levels is crucial for overall health, including hair health. While iron deficiency may not always lead to anemia, it can exacerbate hair loss, particularly in premenopausal women. Monitoring iron levels and considering supplementation when necessary can help manage hair loss and promote healthy hair growth. Alongside potential benefits, hair growth supplements come with risks and side effects. Allergic reactions to ingredients, for example, interactions with medications, and excessive intake can lead to toxicity, and these are possible concerns. It's crucial to consult healthcare professionals before starting any supplemental regime, especially for individuals with underlying health conditions or who are taking medications. To end off this video, let's debunk common myths surrounding hair growth supplements. Myth number 1, more is better. So one common misconception that's taking higher doses of hair growth supplements will lead to faster and better results. However, the truth is that excessive intake of certain vitamins and minerals can have adverse effects. For example, too much biotin may cause insomnia, thirst, urination, and taking too much iron may cause iron poisoning, develop in stages and begin with vomiting, diarrhea, abdominal pain, and may progress to liver failure in later stages. One common issue observed among patients in my clinic is the tendency to take high doses of vitamin D in hopes of improving their hair health, with some individuals even consuming up to 10,000 units of vitamin D for extended periods. Vitamin D overdose, also known as hypervitaminosis D, occurs when there is excessive intake of vitamin D supplements. Symptoms of this condition can vary from gastrointestinal problems, nausea, vomiting, loss of appetite, to more serious complications such as fatigue, weakness, constipation, and moreover, these individuals experience symptoms associated with elevated blood calcium levels, including confusion, frequent urination, muscle weakness. In rare instances, high levels of vitamin D can even lead to formation of kidney stones. It's crucial to adhere to recommended dosage guidelines and to undergo baseline blood tests before starting on any form of supplementation. Myth number 2, instant results. Another myth is the expectation of immediate and dramatic results from hair growth supplements. In reality, hair growth does not happen overnight. It is a gradual process that takes time. Studies assessing the effectiveness of nutraceuticals often measure results after a minimum of 6 months. Similarly, the earliest effects of medications are typically seen around 3 to 4 months. Supplements, particularly when addressing severe deficiencies, take time to normalize the level before noticeable effects are observed. Therefore, patience and realistic expectations are key, as many visible improvements may require months of consistent use. Myth number 3, it works for everyone. Common misconception is that hair growth supplements work equally well for everybody. However, individuals' responses to supplements may vary based on factors such as genetics, underlying health conditions, lifestyle habits, and the specific cause of hair issues. What works for one person may not have the same effect for another. Now, patients with glaringly lower levels of a particular vitamin or nutrients, and correcting these deficiencies result in significant improvement. Conversely, other patients do not respond at all. So it's important to have objective markers of improvement such as trichoscopic images or macro images of hair density to guide the treatment plan. I cannot emphasize enough the importance of managing expectations and understanding that results can vary. After all, supplements can only do so much. So in conclusion, always remember that while hair growth supplements may complement a healthy lifestyle and hair care routine, they are not magical solutions. Prioritize a balanced diet rich in essential nutrients, practice good hair care habits, and consult a healthcare professional for personalized advice. Stay informed, make choices that support overall well-being and hair health.